Nancy, I'm so glad that you joined me because you were like me. You didn't really have any so-called risk factors for breast cancer, right?
Absolutely. Normal, at-risk women, just normal. Never, always had my mammogram, ate healthy, exercised daily, did my breast exam, had my yearly mammogram. So again, I felt as a woman, I wanted to keep healthy, and a yearly mammogram would, in the unlikely event, Joan, that I would have breast cancer, it would be found early. I mean, hence, that's the purpose of having breast cancer screening.
Yeah, because the buck stopped at the mammogram.
Absolutely.
Right? That's the way we always all thought. So you went and got a mammogram and you got a clean bill of health. And
I
this
did.
was in
This
is
is
in
in
2003.
2003. It was my 11th mammogram, and it was my 11th normal mammogram. And I received what I now affectionately call the happygram, which said, "Dear Miss Capello, we are pleased to inform you that the results of your mammogram are normal." You stop there. End of story.
I'll admit.
Yeah, throw it away.
We all
Exactly. Or
read that
file
one
it.
line and we throw it away.
What
or
else
file
is there
it
to
or
read?
whatever.
Exactly.
Yeah.
And so I figured, I was 51 at the time. Now it's the colonoscopy. So I was going to actually schedule one. This was in late November when I had my normal mammogram. And in January, and the first of the year, I was going to schedule my colonoscopy.
So you have a clean mammogram, and then what happens?
So 6 weeks later, being a very faithful patient, never missed an appointment, I went for my yearly gynecological exam.
Okay.
And as my gynecologist was examining my breast, she said, she was doing a clinical breast exam, she said, "You know, Nancy, I feel this thickening." Now think of this, Joan, not a lump, a thickening, a ridge, she said, in your right breast. And I would like you to go for another mammogram. Now, this is the first time I was ever called back for any extra films. And I was not scared, nervous at all. I figured women get called back. Your friends tell you, "Yeah, I had to go back for another mammogram. Everything was fine." So I went back a couple days later for another mammogram, now called a diagnostic mammogram, just in the area of my right breast.
Which, of course, means insurance looks at it completely different.
Exactly.
It's not preventive.
Exactly. And it was normal. But the standard of practice is when a ridge, lump, bump is felt, the next step is you do the diagnostic and then you do an ultrasound. So I go from that room to another room with a handheld ultrasound. Again, it's normal. A mammogram's normal. No risk factors. I'm going to be fine. I eat healthy. Come on. Well, the ultrasound, I'm laying down. They do the ultrasound. The curtain opens. Another like 4 people come in, hovering. You know that feeling.
Oh, yeah.
And I'm laying there and I'm looking up and I'm thinking, well, he's sure cute, but I don't think this is going to be good. Sure enough, a quarter-size suspicious lesion. They didn't know at the time it was cancer. Fast forward, you have the biopsy. It's invasive cancer. It had metastasized to 13 lymph nodes. 13.
So I wonder
lymph
how
nodes.
many mammograms you went and got over those years that never found it.
Well, now I had a team of doctors. I had around 6, and my doctors told me, because I asked that question. I was really perplexed.
Like, how can it be found that late?
I didn't get it. I was stumbling for words. And being an educator, I had my pad, I had my pen, and I'm going around to my 6 doctors, and my question was, what happened? Why didn't the mammogram find my cancer? I don't get this. And each of them said, and I mean this, in a nonchalant manner, like, it's dense tissue. It's what? And I'm leaning in now. I write dense tissue on my pad with a big question mark. What's that? Oh, for women like you, it's very hard for the mammogram to find the cancer. It is?
Like, why didn't you tell me this
Exactly.
before, a few years ago, that we couldn't find your cancer in a mammogram? When it would have been at stage 1 or stage 2?
Exactly. I didn't even understand. The response from these docs, the response was not sufficient for me. Being an educator, researcher, I said, I need to know more about this. I have something that could kill me, that harm me. When I went to the American Cancer Society stage at diagnosis in 2004, when that came up on the screen and it said stage 3C, less than 49% of women survive 5 years.
I-
Tears rolling down my eyes.
And just so I know, what treatment did you go through when you found yours?
When I was first diagnosed, I had a single mastectomy. I had the latissimus, so they took muscle from my back to form my breast. So I still have a good breast, so I'm still a consumer of screening. I had adriamycin cytoxin, so I had 8 rounds of chemotherapy, and then I had 24 rounds of radiation, and I'm still on hormone therapy, constantly being, having surveillance in order, again, to make sure that if my cancer does recur, it's found at its earliest stage.
And what is the prognosis?
Well, again, it's 11 years out. I'm still alive. I'm still kicking butt.
Thank
kicking
goodness,
breast.
because you are a fighter.
Again, I'm a realist too, Joan. I look at the science. My cancer can recur 5, 10, 15, 20 years out.
A lot of women around the country, after I went public, and I said that the mammogram couldn't find my cancer because of dense tissue, a lot of women are hearing that phrase actually for the very first time. So let's explain, what is dense breast tissue?
So there's 4 categories of breast tissue composition that has been reported by the radiologist to your referring doctor, Joan. You probably didn't even know this, for at least now 20 years. So when I had my late-stage breast cancer, little did I know that there was information about my breast tissue composition in a report that I never saw. So keep that in mind, and we'll go to that in a minute.
And it goes A, B, C,
Exactly.
D. And that's from 0%, which is like, as you get older, normally your breast tissue gets very fatty.
Correct.
Which makes it really easy to see cancer in. But if you get up into, if it's 100% dense, they'll never see, see cancer, right?
So there's 4 categories, from A, which is fatty, B is scattered, C is heterogeneously dense, and D is extremely dense. The science has shown that C and D, the heterogeneously dense and the extremely dense, are what's considered being dense or having dense breast tissue. And so, again, as the density increases, dense tissue on a mammogram is white. Cancer is white. There's no contrast. And you like looking for a snowman in a blizzard, or looking for a snowball in a snowstorm. If you can't see it. And my doctors told me that my cancer was there, hidden or masked, for at least 5 years. So think of this, year after year after year, squeezing, hidden intruder, normal mammogram.
I think women, from what I've heard back on social media after I went public and said that I had a clean mammogram that day, just like you had, I think women have been really stunned to hear that they might be going in for mammograms and they aren't working for them. Because isn't it about 45% of women in America are in this category of dense breasts?
Absolutely.
45% of women in America are going every year for taking a test, spending their money, because even if the insurance pays for it, they have to buy their insurance. And we know that it won't work.
Yes. And what's so outrageous to me, when I went to the literature, now this is in 2004, so let's go back 10 years plus of literature. There was science upon science of a couple of things. One, telling me as a reader and saying, am I going to live or die? 40% of women have dense tissue. As the density increases, the reliability of the mammogram decreases, where it misses every other cancer in dense breasts. Now if it's your cancer, that's serious. And that there are other tools, such as MRI or ultrasound, that can find cancers that mammogram miss. Now we have 2 decades of research, plus the research on the risk of breast cancer, of density also, as an independent risk factor.
Okay, a couple of questions. First of all, is this inherited?
It can be. There's a lot of studies now, and again, they're doing more studies about this, about mothers and daughters. And also, density can change over time. If you gain weight, typically the density of your breast will turn more fatty as you get older. Now, I'm not a spring chicken. I would say you're a spring chicken too.
Yeah, right. Aren't you sweet?
However, I still have, and I still have heterogeneous, I still have a good breast. I still have heterogeneously dense tissue in my good breast. And I'm in my early 60s. So there are still women in their 60s, 70s, and 80s that have dense tissue about a third.
And I'm exactly like you, and I still have the dense breast as well. And we should just point out to everybody listening, you can't tell by how you look or feel. This is not a matter of being voluptuous or whether your breasts are saggy. None of those things are related to the tissue inside your breast,
Absolutely,
right?
absolutely.
So
Correct.
right now, the only real measure that we have of breast density is the mammogram.
Absolutely.
Even though there are still those that argue over that, but
Correct.
that is the standard.
Correct. So when I started reading the research and I educated myself, I learned that there was this other report that I mentioned. The report that I got just said, no change from prior exam, everything's fine.
The happygram.
The happygram.
You're fine.
When I went back and got my 11 reports, every report that was written by the radiologist to my referring doctor, to the doctor that actually felt the ridge in my right breast, every report said, patient has extremely, highest category, dense tissue, no change from prior exam. And I often somewhat joke about it, although it's certainly no joking manner, that my breasts were so white that even if there was an elephant behind it, you couldn't see it. You could not see it. So how could a doctor feel comfortable and reliable? It has that there couldn't be something lurking within the density. And the sad thing about that is they can't.
And herein lies the issue. I mean, I think that most women look to their gynecologist
Yes.
as like the warrior, the sentinel guard. They're the ones that are going to make sure that our female organs are A-OK. But as I was told by Dr. Susan Love,
Yes.
breast cancer surgeon recently, not so much. Actually, here in America, in Western medicine, the gynecologists get from the belly button down, and the breast cancer surgeons get from the belly button up. And I said to Dr. Love, but that doesn't make any sense because we don't see a breast cancer surgeon until after we've been diagnosed with breast cancer.
Right.
And she said, bingo,
Exactly.
therein lies the problem.
Absolutely.
But why do you think gynecologists are reticent, because it seems like this is true, they are reticent to speak to female patients about having dense breast tissue and that maybe they need a different test?
From my experience, I think that what has happened is the issue of dense breast tissue and breast tissue composition in the limits of mammogram, that issue was really only known by the folks that did it, the technologists, the radiologists. They never shared that information because if you look at your report, all those 11 reports said at the bottom, it gave a score that everything was fine, basically. So if you're a gynecologist and you're going through these reports, you see Nancy Capel, you're not going to read this 4 paragraphs. You're going to read the last thing. It says, fine, BI-RADS 1. BI-RADS is a different scale. It's what's seen on the mammogram. It was fine. I was great. I had no issue other than I had masking cancer that grew and grew and grew until it had traveled. And I was annoyed finding out this information for sure. But at the same time, I was so pleased, if that's a word, that my gynecologist felt something.
Yeah.
I mean, if I had waited, just in your case, another year, I'm telling you, it would be a totally different story. I would not have survived this disease, and I'm still on hormone therapy. I'm still trying to survive the disease because in the kind of cancer I have estrogen positive, it recurs 5, 10, 15, 20 years out, and I'm worried about that.